Is smoking really harmful? Smoking has long been recognized as one of the leading causes of serious health problems worldwide. Despite knowing the dangers of smoking, many people continue to smoke. Here, we will analyze scientific evidence about the harmful effects of smoking and why it causes so many serious health issues. 1. Impact on the respiratory system. Smoking directly affects the respiratory system. When smoking, cigarette smoke and harmful chemicals enter the lungs and cause many respiratory problems, including chronic bronchitis. Smoking causes inflammation and irritation of the airways, leading to chronic bronchitis. Chronic obstructive pulmonary disease (COPD). This serious condition affects the ability to breathe, causing shortness of breath and limiting physical activity. Lung cancer. Smoking is the leading cause of lung cancer. Carcinogens in cigarette smoke damage DNA in lung cells, leading to uncontrolled cell growth and cancer. Additionally, smoking reduces lung function and causes other respiratory issues like asthma, exacerbating conditions for those who already have them. Cigarette smoke contains many particulates and irritants, increasing the risk of respiratory infections and inflammation. 2. Impact on cardiovascular health. Smoking also negatively affects the cardiovascular system, increasing the risk of heart diseases, including heart disease. Smoking damages blood vessels, increasing the risk of atherosclerosis, coronary artery disease, and angina. Stroke. Chemicals in cigarettes can increase the risk of stroke by damaging blood vessels and raising blood pressure. Smoking reduces oxygen levels in the blood, causing the heart to work harder to pump blood to supply sufficient oxygen to the body. This leads to increased blood pressure and heart rate, stressing the cardiovascular system and increasing the risk of cardiovascular events like heart attacks and strokes. Additionally, smoking lowers levels of good cholesterol (HDL) and raises levels of bad cholesterol (LDL), contributing to the formation of atherosclerotic plaques in arteries. 3. Overall health effects. In addition to respiratory and cardiovascular diseases, smoking causes many other health issues. 3. Overall health effects. In addition to respiratory and cardiovascular diseases, smoking causes many other health issues. Cancers of other organs. Besides lung cancer, smoking increases the risk of cancers of the mouth, throat, esophagus, kidney, bladder, and pancreas. Weakened immune system. Smoking weakens the immune system, making the body more susceptible to infections and diseases. Reproductive health issues. In men, smoking reduces sperm count and quality, while in women, it reduces fertility and increases the risk of miscarriage and preterm birth. Cigarette smoke contains numerous toxic chemicals that can damage DNA, leading to genetic mutations and cancer development. These chemicals also reduce the immune system's ability to detect and destroy abnormal cells and pathogens. Furthermore, smoking affects the skin, causing premature aging, wrinkles, and other skin problems. 4. Effects on others. Smoking not only affects the smoker's health but also the health of those around them. Secondhand smoke. Non-smokers living or working with smokers are at higher risk of diseases related to secondhand smoke, such as lung cancer and heart disease. Children exposed to cigarette smoke are at higher risk of asthma, pneumonia, ear infections, and other respiratory problems. Secondhand smoke contains over 7,000 chemicals, many of which are carcinogens and toxic substances. Children, pregnant women, and the elderly are particularly vulnerable to secondhand smoke. Children living in smoking environments often have higher rates of respiratory illnesses and may face challenges in learning and physical development. 5. Conclusion. Smoking undoubtedly causes severe harm to health. Scientific research has shown that smoking increases the risk of many dangerous diseases, from respiratory and cardiovascular problems to various types of cancer. To protect the health of oneself and others, quitting smoking is essential. Public education campaigns and smoking cessation support programs are crucial in reducing smoking rates and improving public health. If you smoke, consider quitting to protect your health and that of your loved ones. Seek support from doctors, smoking cessation programs, and support groups to succeed in quitting. Quitting smoking not only improves quality of life, but also extends lifespan and provides many long-term health benefits. 6. Benefits of quitting smoking. Quitting smoking provides immediate and long-term health benefits. Some of these benefits include improved respiratory health. Lung function begins to improve within a few days of quitting, and respiratory symptoms like coughing and shortness of breath decrease. Enhanced cardiovascular health. Blood pressure and heart rate return to normal, reducing the risk of heart attacks and strokes. Reduced cancer risk. The risk of smoking-related cancers decreases significantly after quitting. Strengthened immune system. The immune system recovers, helping the body fight infections and diseases more effectively. Improved quality of life. Quitting smoking restores the sense of smell and taste, leads to healthier skin, and saves money. It also improves relationships with non-smokers. Effective tips to quit smoking. Quitting smoking is a challenging but achievable goal. With the right strategies and support, you can overcome nicotine addiction and improve your health and well-being. Here are some effective tips to help you quit smoking. 1. Prepare yourself mentally. Before you quit, take some time to prepare yourself mentally. Understand why you want to quit and remind yourself of these reasons regularly. Common motivations include improving health, saving money, and protecting loved ones from secondhand smoke. Make a list. Write down your reasons for quitting and keep the list with you to read when you feel tempted to smoke. Set a quit date. Choose a date within the next 2 weeks to quit smoking. This gives you enough time to prepare without losing motivation. 2. Seek support. Having a support system can significantly increase your chances of quitting successfully. Let your family, friends, and colleagues know about your decision to quit and ask for their encouragement. Join a support group. Consider joining a smoking cessation support group in your community or online. Sharing experiences and tips with others in the same situation can be very helpful. Professional help. Talk to a healthcare provider about quitting. They can offer advice, resources, and medications to help you quit. 3. Use nicotine replacement therapy (NRT). Nicotine replacement therapy can help reduce withdrawal symptoms and cravings. NRT is available in several forms, including nicotine patches applied to the skin, providing a steady dose of nicotine throughout the day. Nicotine gum chewed to release nicotine into the bloodstream through the lining of the mouth. Nicotine lozenges dissolved in the mouth, releasing nicotine. Nicotine nasal spray and inhalers, available by prescription. These deliver nicotine quickly to ease cravings. 4. Consider prescription medications. There are prescription medications available that can help reduce cravings and withdrawal symptoms. Consult with your doctor about whether these might be right for you. Bupropion. This medication helps reduce withdrawal symptoms and the urge to smoke. Varenicline Chantix. This medication reduces cravings and the pleasurable effects of smoking. 5. Change your routine. Smoking is often linked to certain routines or activities. Changing your routine can help break the association with smoking. Identify triggers. Recognize the times and situations when you are most likely to smoke and plan to avoid or change those routines. Stay busy. Keep yourself occupied with activities that don't involve smoking. Exercise, hobbies, and spending time with non-smokers can be helpful. 6. Manage stress. Stress is a common trigger for smoking. Finding healthy ways to manage stress can reduce your reliance on cigarettes. Practice relaxation techniques. Techniques such as deep breathing, meditation, and yoga can help reduce stress. Practice relaxation techniques. Techniques such as deep breathing, meditation, and yoga can help reduce stress. Exercise regularly. Physical activity is a great way to relieve stress and improve your mood. 7. Use behavioral therapies. behavioral therapies can help you develop strategies to quit smoking and stay tobacco-free. Cognitive behavioral therapy (CBT). This type of therapy helps you identify and change negative thought patterns and behaviors related to smoking. Motivational interviewing. This counseling approach helps strengthen your motivation and commitment to quitting. 8. Stay positive and persistent. Quitting smoking is a journey that may involve setbacks. It's important to stay positive and persistent. Celebrate milestones. Reward yourself for milestones reached, such as 1 day, 1 week, and 1 month without smoking. Learn from relapses. If you relapse, don't be discouraged. Analyze what led to the relapse and use it as a learning experience to strengthen your resolve. 9. Avoid alcohol and other triggers. Alcohol and certain social situations can weaken your resolve to quit smoking. Limit alcohol consumption. Try to avoid alcohol, especially in the early stages of quitting. Socialize with non-smokers. Spend time with friends who do not smoke and avoid situations where you might be tempted to smoke. 10. Stay committed. Remind yourself daily of the benefits of quitting and the reasons you decided to stop smoking. Visualize success. Picture yourself as a non-smoker and imagine the positive changes in your life. Keep a journal, track your progress and feelings throughout the quitting process. Writing about your experiences can be therapeutic and motivating. Conclusion: quitting smoking is one of the best things you can do for your health. With preparation, support, and the right strategies, you can overcome nicotine addiction. Remember that the journey to becoming smoke-free is a process, and it's okay to seek help and take one step at a time. Stay committed, and soon you will enjoy the many benefits of a smoke-free life.